As voters grapple with various social and economic pressures in their daily lives, the need for access to reliable, affordable and quality mental health care has never been greater and looms as a determining factor for this year's federal election results.
According to the ABS, more than 40% of Australians have experienced a mental disorder at some point of their lives, and with more than 3,000 deaths by suicide recorded each year in Australia, it is clear that there is a need for a robust and secure national mental health care strategy.
However, there are many challenges for those seeking access to effective psychological support and for those working in the mental health sector. We talked to the president of the Australian Psychology Society, Dr. Sarah Quinn, about the stresses on this sector.
There is a current and critical shortage of psychologists in Australia, and our current psychological workforce only actually meets 35% of the demand for mental health services. It's really quite prudent that the government steps up to support psychology and the wellbeing of Australians.
We also talked to psychology student and the academic events manager of the Society of Neuroscience and Psychology Students at Monash University, Tia Miragliotta, who spoke about the difficulties for psychology students.
The competitiveness of getting into psychology, and there's this funnel of, we have all these people who are studying psychology, but the course is so competitive to get masters, to get clinically registered. It's basically nearly as long as a medicine degree. You need to do your 3-year undergrad, an honours, and then either a master's or a PhD, which is another 4 or 5 years, which includes placement as well.
Regarding the stresses for psychologists once they enter the workforce, Tia said it was crucial to support workers in what is a demanding profession.
You're hearing the inside of people's lives, people's difficulties, their struggles, all day long.
Dr. Sarah Quinn also addresses what is driving mental health struggles for many Australians.
We know that the current cost of living pressures are having a significant and negative impact on Australians' mental health. We know that nearly 40% of 16 to 24-year-olds experience a mental health disorder, and that's why we're proposing that we need a youth Medicare safety net for psychological services, which we don't have yet.
As part of the 2024-25 budget, Labor has committed to an $888 million mental health package to be rolled out over 8 years. A major feature of this plan is to establish a network of 61 Medicare mental health centres throughout Australia, where patients can walk in and receive free services. The package also includes the establishment of a free digital service for those with mild to moderate mental health challenges. The 2025-26 budget reinforces this by dedicating an extra $46 million to continue digital mental health services.
Under Medicare, Australians only have access to 10 sessions with a psychologist, and that's throughout that calendar year. And so we know from research and from what our patients are saying is that these 10 sessions are just simply not enough.
Mental Health Australia says whilst the current plan is broad, the investment is not deep enough. The group argues that more long-term sustainable reforms are needed. Labor has also reduced the number of Medicare subsidised psychology sessions to 10 after the previous coalition government allocated funds for 20 during the pandemic. The coalition plans to restore funding to ensure that individuals can claim up to 20 Medicare subsidised sessions, with a psychologist as part of a plan to invest a further $400 million into youth mental health care.
Reinstating 20 sessions could save lives. It could also improve the quality of life for patients and increase the productivity in the economy.
As Australia awaits the result of the federal election, a significant challenge for whoever forms government will be to ensure adequate mental health care across Australia. Rahul, Deepak, Kumar, Mojo News.